Hello and welcome to this special Ladies Lounge edition on cervical screening. I know this is something women may not find strange, but we want to talk about it because it's an all-important subject. And I have here with me today a very special guest, Dr. Vanessa Apea.
Hi.
I hope I got it right.
Perfect.
I have practiced.
You have?
You're very welcome to our show.
No, thank you so much for having me.
Yeah, we're very glad to have you because, I mean, cervical screening, we don't want to be statistics.
Yeah.
We don't want to fall in that bandwagon of people who don't check and then fall into trouble.
No.
But just before we get carried away with the conversation, let's start from the beginning.
Yeah.
Because I know there may be some people who haven't paid the subject attention and they may be hearing this for the first time. So what is the cervical screening about? What is it?
No, that's great, because I think you're so right. Many people will hear the words, but actually thinking, what actually is cervical screening? So cervical screening, the key thing is that it's not a test for cancer.
Okay.
So it is a test in which we test for cells within the cervix.
Okay.
And we're looking for something called HPV, human papilloma virus.
Okay.
And there are different strains of this virus. So there are high risk ones and low risk ones. And the high risk ones are associated with cervical cancer.
Right.
So we look for the high risk HPV, human papilloma virus. And then if it's there, it tells us that someone could be at risk of developing cervical cancer.
Right.
So they could be at risk of the virus affecting the cells of the cervix to become abnormal, and this could potentially lead to cancer.
Right.
So it's screening for that. And I think it's just great to have the opportunity to talk to you about it, because so many people think, oh, it's definitely a test for cancer. And most people, when they go for screening, the test is normal. They don't have the virus. But if they do, then there are more tests that we need to do to investigate and intervene early.
Right. I know in this country, we get letters to go for the tests. And this is a normal thing.
Yeah.
I mean, the GP sends the letter every so often, a couple of years, I think.
Yeah.
And, but it's almost like we don't know the details, as you've told me now, as you've told us now. It's almost like we don't know these details. Is this the reason for this campaign?
Exactly that, because I think for a number of reasons as well, because there was a study that was done earlier this year, and it looked at about 3,000 women, and about 17% of South Asian women and 11% of Black women. When they responded, they said that they had put off or hadn't responded to the letter that they received from their GP.
Right.
And when you look at the national average of women or people with a cervix that don't go for it, it's only about 7%. So in Black women and South Asian women, we are more likely not to attend our appointment.
Right.
So this campaign is really to raise awareness and to remind people that, we've all got busy lives. We all have our own reasons why we may not go, but don't forget about it. If you get your letter, go and do it.
Yeah.
If you've missed it, it doesn't matter. Go to your GP or your local sexual health service and go and have the screening.
Right. So you're saying Black women are less likely to attend their screening. Did this survey say why?
So it looked into some of the reasons, and there were a number of reasons. So for some women, they talked about just feeling shy about going, which is completely understandable. And I think that, when I talk to my friends about it and I'm like, saying you have to go, it's one of the most commonest things. Oh, I feel shy, I don't want to be exposed, what's going to happen in that. Some people also just simply said, we've all got other stuff going on in our lives, and it's how we prioritize things. So if we're thinking about work, we're thinking about how we fit it in. So some women said they mainly just forgot about it. And then there was a significant portion of women that said that they were worried about it being uncomfortable. So they were thinking, gosh, what's going to happen? So instead of, again, if there's a reason why we don't want to go for something, if we're thinking we're going to be in discomfort, then we're thinking, okay, let me delay it. So those are the key reasons that came out.
Right.
Yeah.
So given that now, what you've said, what will you tell us, tell our viewers, tell everybody, how important this going for this test is.
Yeah, it is so important, you know. So we've got about 2,700 women that are diagnosed with cervical cancer each year, and we have about 2 women a day that die from cervical cancer. But we have a screening tool for everyone that the earlier that we identify and we see that someone's at risk, the more that we can monitor someone. If we do see abnormal changes there, then we can intervene early. So we've got something that can make a difference. And so if we've got something that is affecting women significantly, but we've got a way of preventing it, then we should be taking that. And so I just encourage everyone, you know, completely understand the reasons why not, but it's so important.
I think this brings me to the next question, is what to expect. You know, what happens during the screening?
That's such a good question, because I always find that, you know, when I talk to friends, everyone's got a very, very different idea of what happens within it. And so when you go for the examination, first of all, it will be done by a healthcare professional. So it could be a specialist nurse, the practice nurse, it could be your general practitioner or a doctor in a sexual health service. So you'll go. You will have to expose yourself from the lower half down, but you will be covered, and your dignity will be respected in that way. And then we will look at the outside of the vagina, so we'll look at the outside, and then we'll use something called a speculum. So it's an instrument that we use, and we pass into the vagina, and we open it up, and then that gives us a really good view of the cervix. And so we look at the cervix, and then we take some cells from the cervix, and then we put it in a bit of fluid, and we send it off. And then we will cover you up again, and then allow you to dress. And it's something that takes, you know, less than 5 minutes, less than 5 to 10 minutes. So it's a swift opportunity for you to protect and prevent something in the future.
So do we have a chance of choosing who we want to carry out this procedure on us?
Yep. So one of the things is that, so you can have it done at your GP practice, and you can have it done or a sexual health service. And sometimes on the letter, depending on your area, they will give you other places that you have an opportunity to have it. I always say, if the key thing is that we want women to go and have the screening. So if there is something that is concerning you about it, and you're thinking, you may be, I don't know if I want my GP to do it, I want the nurse to do it, or I'm concerned about someone else in the practice or the clinic, ask. Say it. Because
some people maybe because of religious reasons do not want, you know, to have someone of a different sex, you know, examining them and all that.
And the key thing I always say is that we're experienced at this. We do this every day, and it's so important for people to feel at ease when we see them. So often what happens is when people don't ask, that's when I actually get upset, because I think, oh gosh, if there was something that I had known to make it easier for you, then we would have facilitated that. So if you don't feel comfortable and you're saying, right, I don't want a man to do it, you can ask for a female person. You can have a male person doing it, but male people have a chaperone, so they can have a woman in the room with you as well. So you can choose, so don't feel shy to ask about it.
And ask we should really, if that would make the process actually happen.
Exactly.
Okay, so when you've had the test, when do you expect to get the result? And will the GP call you, or how do you know what has happened?
Another great question. So you will get the result generally within 2 weeks, and you will receive a letter. So you don't need to call and seek it. You will receive it routinely. And then that will give you the indication. So it will say whether they saw the virus there, and then they will tell you what needs to happen next. Do you need to be seen again more sooner, or do you need to be seen again in 3 years or 5 years?
Right. So it's either, it'll be explained. Exactly.
And there is information on the letter for you to help you understand what the result means. And so I always encourage people to just read it, because often people, they look at the letter, they scan it, and then they put it aside. So read it, understand what the result is, look at the explanation, and then look at the next steps.
So if it's a negative, as it were, result, would the attachment to that letter be a generic one? Because that always seems to be the case with appointments. Yeah.
It will be. So it will say whether there's a presence of HPV, as I've mentioned. And so it will say whether it's there or it's not there. And then it will have, like, you know, the standard information there. But what is tailored to you is the next steps. So if does it mean that you need to be seen routinely in the 3 or 5 years, depending on your age? Or does it mean that we need to do something else sooner? So then they will let you know that you'll be receiving another appointment.
Thank you. Okay, so what if you move houses?
So here, I think, is so important about communicating that you've moved houses. So if you've done it through your GP, let your GP know that you've moved houses, so they have an up-to-date address. So even if after you've done the test and the screening, and then you've moved, let your GP know. If you did it at a local sexual health service, let them know as well. Because I think what's important here as well is that you don't, as I've said, you don't need to be registered with a GP to have the screening. So so you can go to your local sexual health service and, you know, self-refer. But the key thing is that everyone knows where you are, so they can give you the result and follow you up appropriately. And sometimes we forget to do that, so it's a really good reminder, and that's important across health in general. So when we come back, we'll touch more on the things that make women uncomfortable and the things that hold them back from doing this screening. Please don't go anywhere. We'll be right back.
2 women in England die every day from cervical cancer, but it is also one of the most preventable cancers, and cervical screening can help stop it before it starts. I'm joined by some amazing women to have some life-saving conversations. So let's just talk through any questions that you've got.
So is cervical screening a test to see whether you've got cancer?
The cervical screening is not a test for cancer. So within your screening, we test for human papillomavirus, HPV, which is the primary cause of cervical cancer. And this virus can affect some of the cervical cells. Those changes can lead to cancer. But don't be alarmed, as having HPV does not mean you have cervical cancer.
My biggest worry is the pain during the screening.
For most women, it isn't painful, but if it is painful or uncomfortable, the key thing is that you let that healthcare professional know. You've got to remember that you are in control and you can stop the appointment at any time.
So the screening, I know they say once you're like 25, that's when you have to start getting it. But if you're not sexually active up until that point, do you still have to get screened?
Within the NHS, we advise all women aged 25 to 64 to go for cervical screening, regardless of their sexual activity.
I think also I have like a lot of friends that are, and myself, worried about going to the doctor and having to be in such a vulnerable position.
No, of course. And again, completely understandable. It's our responsibility to make you feel at ease. So when you're booking the appointment, if you would prefer a female, do let us know. Remember, cervical screening saves lives. Don't ignore your cervical screening invite. And if you missed your last one, book an appointment with your GP practice now. For further information, please visit nhs.uk/cervical screening.